Hello everyone, this is Dr. Stefan. In this video I'd like to answer a question about getting shakes from inhalers. So this is a common one. This is a common issue that comes up in clinic, and I have a comment on my channel about it, of course. So is it normal to have shakes for half an hour after taking the morning dose of an inhaler, yet not after my evening dose? Why is it that sometimes I get particles in my mouth and other times nothing? So this is, of course, this is two completely different questions, but let's go with the shakes first. Let's talk about that first. So first of all, this is a comment that was addressed on a video on how to use Foster. Foster is an inhaler that contains two medications inside. One is an anti-inflammatory medication, an inhaled corticosteroid, beclomethasone, and the other one is a bronchodilator, which is called formoterol. Less important, the idea is formoterol. So this bronchodilator, this medication that opens up the airways, can be found in many inhalers that are used for asthma, for COPD. So when you take these inhalers, you can imagine that these medications that you inhale, they help relax the muscles around the airway, so it opens up the airway a bit to help you breathe easier. So it relieves the symptoms. However, when you take these sort of medications, sometimes they can have a bit of a stimulant effect. So they may actually make your heart rate increase. So your heart may be racing a little bit. You may get a little bit agitated from inhaling this medication, and you can get a bit of a tremor, a little bit of shaking. That's something that can be more or less severe. In most cases, it's very mild and it's nothing to worry about. It's something that, you can mention it to your doctor, see if you can try a different inhaler, see if there's anything you're doing that's not right, see if you're taking too much of the medication, more than you need. So then that's one other thing. Now, whether it's worse in the morning versus the evening. So this is an interesting one. I'm not really sure if I have the clearest answer possible, but I have just some things that I may think about. So one would be, do you have a better technique when you take the inhaler in the morning? So that can vary the dose that you're inhaling. Maybe you haven't had breakfast, you haven't eaten, so you're already sort of agitated a little bit by that. Or it could be that many people have a lot of coffee in the morning, so they're already sort of having that stimulant effect from the coffee, from the tea that they're having in the morning. So taking the inhaler on top of that maybe causes a little bit more shaking than in the evening. These would be some explanations off the top of my head, but it may be a different situation in your case. So if you struggle with this as a side effect from the inhaler, discuss it with your doctor, mention it. But if it's very mild and it's not affecting your life in a major way, probably it's something you can use as a sort of a trade-off. So you have this little side effect from the medication, but if it's controlling your asthma, well, then maybe that's a good trade-off. So on balance, is it bad enough? Discuss it with your doctor and see what's the situation in your case. You can try a different inhaler, like I said, a different dose. A lot of things can be achieved. Now, coming back to inhaler technique, because this is really, really important as well. So in the comment here, it was mentioned that sometimes there's a feeling that there are some particles in the back of the mouth. This is usually to do with technique. So with some inhalers, when you take them, you might feel that there's something going in. There's a bit of a powder going in. If that's the case, usually it's to do with suboptimal technique that can be improved. So I have some videos on my channel on how to use inhalers. Try to check these out as well. Or simply take the inhaler with you to your consultations and show it to your doctor. Show them how you're actually using the inhaler, because they may give you some direct feedback on what you can improve. That's one thing. So if you're having this sensation that there are particles in the mouth at some points and some inhalations but not others, it may be that it's basically the variable techniques. And the other thing you could do is just basically take some water after you've taken the inhaler, swish it around your mouth, gargle and spit, and that can get rid of some of that powder that's left that can sometimes cause some problems. So hopefully this was helpful. Try to improve your technique, discuss with your healthcare providers, and if you have further questions, leave them in the comment section below. All the best and good health.